If you're starting to feel tired all of the time, you're struggling to build muscle mass, and you're losing your sex drive, you may have low testosterone, but have no fear. In this video, I'm not only going to show you how to address it, but I'm going to give you a secret to get a free testosterone test and cheap treatment at the end of this video. So stay with me as I explain low testosterone and how it might be affecting you. So as you likely know, testosterone is a hormone produced in the testicles, and you need sufficient levels of this hormone in order to stay at a high energy state, maintain your high libido, and even erectile function. But as we get older, as men, unfortunately, our testosterone levels start to naturally drop. There's also several things that you could be doing in your lifestyle that I'm going to teach you that could be affecting your testosterone. But the point is, as you age, there's no way around this. Your testosterone levels are going to start to decline. Usually at the age of 30, they start to decline, and how fast that decline occurs is very dependent on the individual. In fact, some men might not even experience a decline until their 40s or 50s. This is called andropause, and there's no way around it, but there's a lot of things that you can do about it, because in my opinion, it is not worth living a life with low energy levels and low libido. There's a lot of treatments that we have available to us in modern society that I'm going to be teaching you about, as well as some of the risk factors involved. And before we get into some of those things, my name is Dr. Jay Feldman, graduated osteopathic medical school, did not get board certified, I went into business instead, but this is not medical advice. This is my opinion, man to man. So please see your doctor about anything that you hear on this channel, and always counsel them before starting any new medications. So what is a normal testosterone level? Well, the range is massive. It's between 300 and 1,000 is considered normal. And over the past several decades, we've seen the average testosterone in men drop significantly, which is a very scary statistic. The point that I'm trying to make is that between 300 and 1,000, it doesn't really matter where you are. What matters is your symptomatology. You could be at 400, which is relatively low, and have no symptoms, or you could be at 500 and have symptoms. So this is where you work with your doctor to look at what level of testosterone you are, look at your symptomatology, and it might be worth treating regardless. It's also really important to track changes in testosterone. Maybe you're 40 years old and your whole life you've been at a testosterone level of 800, but now you're at 600 now that you're 40 years old, and you're experiencing fatigue, you're experiencing low libido. It might be worth working with a doctor to get up to 800. And I'm going to show you exactly how to think about that, how to get a test absolutely free, and then how to get treatment for this. Now, important to note, if you think that you might have low testosterone, think about the symptoms that you have. Has your energy levels been dropping? Have you had a lack of libido? Have you experiencing fatigue or trouble building muscle mass? These are all symptoms of low testosterone. So if you're experiencing any of these things, go to your doctor, get checked. It's a simple blood test, and they're going to be able to tell you how much total testosterone you have, how much free testosterone you have, and it's worth checking your PSA levels as well. Now, before we talk about treatment options, it's really important to talk about testing. It's good to know your numbers regardless. I test my testosterone at least once a year, even though I'm 31 years old, just to stay on top of it. I don't want to see any rapid declines, and I do use supplementation, which I'll be talking about in this video, to help keep my testosterone levels nice and high. So if you think you might be experiencing symptoms of low T, or you just want to make sure, check your testosterone levels to make sure they're in a comfortable range, go talk to your doctor, get a simple blood test. It'll give you peace of mind just to know, to cross that off the list and say, okay, I'm having these symptoms, but maybe it's not my testosterone. Or maybe I'm not having symptoms that I know about, but my testosterone levels might be really low anyways. So getting them up to a high normal level could really optimize my life and add some energy and vitality to my life. Now, we are blessed to live in a day and age where seeking treatment for low testosterone is totally mainstream. It's totally accepted in the United States, and it's very accessible. And there's a lot of physicians now who are much less hesitant to treat you if you're low normal. Back in the day, and this is from what I hear, obviously I wasn't alive back in the day, it was very hard to get treatment for this. It was all stigmatized as anabolic steroids, and people weren't really treating their low T unless they had a serious problem. Nowadays, it's as easy as scheduling a virtual consult, getting a test. They'll even come to your home, and they'll treat you even if you have low normal levels, as long as you have side effects. Now, here's what I advise you to do. Get a test. Go find out what your levels are. If you're low normal or you're symptomatic, I encourage you to change as many factors within your lifestyle as you possibly can control. Some major things that you could be doing in your day-to-day life that are affecting your testosterone levels. Biggest one, obvious one, your diet. You need to be eating a clean, healthy diet, no plastics. Microplastics are one of the assumed causes for the decrease in testosterone testosterone over the decades. I attribute it to several other things. Video games, screen time, definitely cut it out. Get time in the sun. There's nothing that can replace good time in the sun, some natural vitamin D. Go to the gym, exercise, run, lift heavy weights. All of these things activate testosterone. Some things that will kill your testosterone. If you're trying to drop your testosterone levels as fast as possible to zero, here's what I recommend that you do. Eat food out of plastics every day. Eat lots of microwave dinners, eat lots of bagged food. This thing will really destroy your testosterone. Don't exercise. You should play lots of video games, watch lots of screens. Definitely don't run, definitely don't lift weights. Definitely don't do any combat sports because fighting is definitely really good for testosterone. I definitely don't recommend doing Muay Thai or Jiu-Jitsu if you want to decrease your testosterone levels. Don't supplement. There's several herbal supplements that can increase your testosterone. So if you're trying to hit 0T, definitely don't take herbal supplements. If you're struggling with low T and you're obese, the fastest way to increase your testosterone is to drop body fat. There's a direct correlation because of a chemical reaction that happens in your fat cells that destroys your testosterone. So if you're struggling with low T and you are struggling with obesity, I definitely don't recommend starting TRT, which is injections or exogenous testosterone. The first thing that you should do is find a way to lose weight. This will dramatically increase your testosterone naturally and be sustainable so that you don't have to take TRT in the near future. Now, assuming that we've optimized all of our lifestyle things that we can, the next step might be supplementation. Before jumping into TRT, it might be worth it to start herbal supplementation. There's a lot of great herbs out there. Some ones that I recommend are tribulus and Fedosia agrestis. And if you go onto Amazon and search for testosterone boosting herbal supplement, find one with great reviews, get it. It's probably sufficient. And that will probably help you get at least 100 points up on your testosterone level. Try this for a few months and then get a follow-up testosterone test 3 to 6 months later and see what those herbals and lifestyle changes have done to your levels. If you're back up and you've gotten a 300 point boost and you're in high normal and you're feeling great, awesome. There's nothing left to do. However, if you're in the subset of men that are not getting adequate results with lifestyle changes and herbal supplements, we have some excellent options for you. TRT, also known as testosterone replacement therapy, is the practice of administering exogenous testosterone to get your levels up to where you want them. You need to do this in conjunction with a doctor. It is not risk-free, and there are several different forms that you can consider. I'll do a separate episode digging into each individual form. I just want to let you know that these options are out there. They're available to you. And if you're suffering from symptomatology of low T, they are a great opportunity, especially as you're getting older, and there is no way to lifestyle change your way into having the testosterone levels that you did when you were 30. This could be a great option for you. I do want to preempt all of the positives that I'm going to note with the fact that increasing your testosterone levels exogenously does come with side effects. One, your testicles will shrink. If you're administering it exogenously, your testicles are going to say, oh, I guess I don't need to make this anymore. They're going to shrink. So if that bothers you, this might not be an option unless you want to get a silicone implant. Number two, it could cause hair loss. There are DHT blockers like finasteride that you can take to counteract this, but it may cause hair loss, it may cause acne. It may cause an increase in the size of your prostate. Again, there are medications you can take to counteract this, but this is relatively common when administering testosterone. It's also really important to note that when you start a consistent cycle of exogenous testosterone, you might not be able to come off of it and get back to normal levels. So make sure to talk to your doctor. There's a long list of items that I would need to go through that I do not have time on for this short video because I want to deliver value for you. And as promised, I'm going to teach you how to get a free testosterone test. They'll come right to your house. They did it for me. Take your blood, send it to a lab, and then you get to go over your results with a clinical practitioner that is an expert in TRT and in testosterone levels, absolutely free. This is something exclusive for my audience. All you have to do to claim this is go to the link in the description, enter your information, and schedule your free consultation. They will literally come to your house and test your blood for free. This is usually more than $100 just for the test, and then a consultation, also absolutely free. Sorry, correction, it's $1. It's basically free. It is $1 for the test and for the consultation. And then if you need treatment, the company will obviously help you out with treatment at an additional fee, but a very reasonable one. So go to the link in the description. Again, this is only for my subscribers. So please go to the link, please book your free test, your free consult, and I hope this is helpful for you. So if you need TRT, and you might be in a position where there's nothing else left to do except administer TRT. You want your lifestyle back, you want your libido, you want your energy. There's injections, there's patches, there's gels, there's all kinds of options that you can talk to on your consultation that might be a good fit for you. Again, this is mostly about lifestyle, personal choice. They all essentially do the same thing. Some people want to get injected once a week, some people want want to wear a gel. Again, this is for you and your physician, your practitioner to discuss. If you're suffering from TRT, schedule a consultation and a lab test. It's important to know your numbers. You need to stay on top of this as you get older and as you age. There's no way around this, man. As you start hitting 40, as you start hitting 50, do you want to sacrifice your lifestyle? Do you want to sacrifice your energy, your vitality, your libido, your sex drive? I personally do not. So this is something that I'm going to be staying on top of as I age, and I encourage you to do the same thing. If you want to see more videos about this, some hacks that I have to increase my testosterone naturally, some supplements that I take every single day to maintain high testosterone levels, you're going to want to be subscribed to this channel. You're going to want to click the videos and watch more. And thank you for joining me, and I'll see you in the next one.